Hi, my name is Dr. Mona Pourramazan. Today I would like to talk about why primary care is important for you. But before I start my presentation, I would like to give you a little bit of information about my background. I graduated from medical school in Iran, and then I moved to United States. I finished my residency in internal medicine, and then I completed training of integrative medicine in Arizona University program. But before I start my presentation, I like to share my personal story and journey in medicine. During my residency in New York, I witnessed several patients with critical care conditions. They required immediate care. Unfortunately, after treatment, some of them came back to the hospital a few months later with the same issues. So I realized as much as I like to treat their acute care, but I also like to help them to prevent all these hassles. One thing that was common among frequent admissions was the fact that unfortunately they didn't have continuous care after being discharged. If they had, though, it could have prevented more suffering, critical health situation, and saving time and money also, as well as medical resources. As a result, the necessity of primary care inspired me to become passionate, to build up good relationship with my patient, and seeing them suffering and seeing also the burden of the medical team made me eager to help and educate my patients. That's when I decided to become a primary care physician. Okay, so one could ask, what is important of primary care, doctor, and how can this benefit you? Maintaining a routine, regular relationship with a primary care provider has proven to help people managing chronic condition and promptly detect new issues. As I mentioned, the most important role of primary care physician is to prevent critical care situations. For example, if your doctor detects a patient with high blood pressure, they can prevent serious health issues, including heart attack and stroke. Another role of primary care physician is managing chronic diseases such as diabetes, which can be very helpful to prevent serious complications of uncontrolled high blood sugar, including non-healing ulcers, kidney, and eye damages. We use several screening tests to detect cancer, high blood pressure, and cardiovascular disease. On top of it all, we want to make sure that not only our patients are disease-free, but also they have general wellness. According to World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. As you see in my slide, additional benefits of primary care are and including continuity. When you have a primary care physician, they have your records, and therefore when you go there, they don't ask you if you have anyone in your family with heart disease, or they don't ask the list of your medications because it's already there. Having a primary care physician also brings convenience, as you have access a variety of health services, including preventive care, screening care, and chronic and acute care conditions. You can also update your immunization and obtain education regarding lifestyle, proper nutrition, exercise, and also you get more education and consultation regarding smoking cessation and general wellness and prevent from unwanted disease. I would like to briefly go over screening tests that we usually order, including CT chest to detect lung cancer, mammogram for breast cancer, bone density for osteoporosis, as well as blood tests for diabetes detection and high cholesterol as well. And we want to detect these medical conditions in the early stage because it's easier to manage and it's easier to prevent from complications. And also colonoscopy, which is important to detect colon cancer in early stages. As you see in this diagram, the death rate of heart disease and stroke have significantly been reduced, and part of it is related to early detection and management of the chronic disease and also the treatment. In the next slide, we see the cancer death rate also dropped 27% from 2001 to 2020, and part of it is due to adhesion to proper screening tests as well as significant improvement of cancer treatment. Death due to breast cancer, colon cancer, and prostate cancer, and also lung cancer are reduced substantially. As you see in this slide, 52% for prostate cancer, 39% for breast cancer, 52% for colon cancer, and 19 and 45% for lung cancer, which all can be detected early with screening tests. The last subject I would like to discuss is well-being. Well-being and general wellness is a new era in medicine, and a lot of physicians like me are very interested in this field because we believe people are multidimensional. And in order to have a better outcome, we need to consider a person as a whole. Holistic approach is about caring for the whole person. It is rooted in the understanding that all the aspects of a person, including physical, mental, spiritual, and social aspects, would affect persons overall. Through holistic approach, the root causes are identified and then they are being addressed in a variety of ways, starting with diet, lifestyle, several interventions, supplements, herbal, and prescription medication if necessary. I would like to thank you for watching my presentation. I hope it was helpful and useful for you. Thank you.